It's my pleasure to introduce Sheriff Svensson, who grew up in Clatskanie, Oregon, where he began his law enforcement career in 1995 as a cadet with the Clatskanie PD. He earned a Bachelor of Science in Law Enforcement and studied public policy and administration at Western Oregon University. He was hired by the Yamhill County Sheriff's Office as an intern in 1999 and full-time as a deputy in 2000. He served as a deputy, canine handler, sergeant in both patrol and corrections divisions, administrative sergeant, and as an operations captain. He was elected Yamhill County Sheriff in 2014. In 2017, Sheriff Svensson was recognized as the Northwest CIT Crisis Intervention Team Agency Executive of the Year for his continued work involving mental health. He was asked to join a national joint task force through the National Association of Counties and National Sheriff's Association, whose goal is to reduce recidivism through promoting continuity of healthcare services for veterans and those on Medicaid. After retiring as sheriff in 2023, he was hired as the executive director for the Oregon State Sheriff's Association in January 2024. So without further ado, it's my pleasure to welcome Sheriff Svensson.
All right. Wow, that was a pretty impressive introduction. I was just expecting Tim Swenson from the Oregon State Sheriff's Association. I feel like I need to update that. Appreciate you guys listening to myself. I've got a couple other people I'm going to call up here in a second to talk about a project Oregon State Sheriff's Association was able to partner with Unitas on a closed loop referral system for reentry for individuals into from the custody back into the community. So without further ado, I'm going to invite Abigail and Brent from Clackamas County to come on up here and join me. And then she's got a little PowerPoint. We're just going to kind of use this as an open time just to kind of talk about the project, how we got to where we are, kind of what the software platform looks like, and then a little bit of a lived experience with Clackamas County on how it's working. And then obviously open it up for a little bit of questions in case you have any questions at all. So, you want to run the clicker? Since
yeah, I don't have my slides yet, so we can.
I think they're right there.
Yeah, before I hop into my slides, so you want to talk about kind of what prompted.
Yeah, so you heard my history prior to when I was serving as the sheriff of Yamhill County. Right after I got elected, one of the things that really bothered me was that individuals that were in the community that were eligible for resources and treatment, the moment they came into my facility, they were no longer eligible for those same treatments. And the coverage that they had through the Medicare or Oregon Health Plan was all cut off. And so we started having conversations at the state level. What would that look like? How do we work with this? I had an opportunity to serve on a national task force with NACO and NSA to have the same conversation. And now, almost 10 years later, the Oregon Health Authority was able to successfully put together the 1115 Medicare waiver for adults in custody, which is a huge benefit to jails. So now we're able to, anybody who's within 90 days of being released from custody will be able to continue and be re-enrolled in the Oregon Health Plan and have those services brought to them. So fast forward to last session when we started having the conversation around 4002, we started talking about involving more individuals in different deflection programs and with the recriminalization piece of drugs, that we knew that there was going to be a time where people were going to find themselves back into the facilities. So we started having conversations on how do we get individuals who are in custody connected to the resources that they need to be connected to prior to release. It's hard enough for individuals who have full-time jobs, have families, and are college educated to keep their schedules intact And it's hard enough for us to track down resources. And to ask someone who is somewhat in crisis and has the uncertainty of not knowing what they're going to be doing when they get back out into the community. A lot of them don't have housing, they don't have jobs, they don't have basic skills to look for a job, they need food, I mean, you name it, everything that they need, there's resources available, but no one knows how to get to it. So as we started talking about this, we had the opportunity to partner with Unite Us, and Abigail will talk a little bit more here in a little bit about what Unite Us is. But from my sense, from layman terms, it's a really cool system that connects everybody to every resource that's possibly available in your community. And when I enter an individual into that system, I can connect them to the food services, I can connect them to housing, I can connect them to veterans, doctors, psychology, drug and alcohol. Every partner that's in the system through the local CCO then gets notified through this closed loop referral. And when they get notified, they get connected to that resource. And then the big piece for me is that we get to see how did that end up. They didn't just get kicked out the back door and sent on their way. We actually be able to get to close that loop of determining whether or not the resource was met, whether they were eligible for the resource, and then the provider has to close that out with some sort of close code. And that code tells us whether the individual participated in the resource, they showed up to their doctor's appointment, or for housing, for example, there may not be housing available, therefore they're not eligible and they can close it out. So as we started that conversation, it was just perfect opportunity for us to partner with this pilot program. And out of the funding that was associated with 4002, the Oregon State Sheriff's Association was able to earmark enough money through the CJC to partner with Unite Us to pay for the platform. And initially we were going to have 3 counties on board. We currently have 2 that are active, running a pilot program, using the system to connect individuals prior to release to resources. So without further ado, I'm going to pass it over to Abigail where she can talk a little bit more about Unite Us and what it's all about.
Okay. Is this on? Yes? Okay. I'm going to just stay seated so we can just have a conversation here. Hi, everyone. My name is Abigail Oswald. I'm our Associate Director of Government Partnerships at Unite Us. I live in Portland, and it's really just an honor to be here with all of you today. You do such important work in our state, keeping our citizens safe and making sure that folks have everything that they need as they're reentering their communities. So I just want to say thank you, first of all, for all of the really important work that you do. It's really been such an incredible experience to partner with Tim and OSSA and the counties that we're working with Clackamas and Brent. So yeah, just a lot of gratitude for everyone in this room and this work. I am going to just tell you a little bit about who Unite Us is to just contextualize some of the work that's happening in the pilot. But I want to move through this as quickly as I can because I want this to be less about Unite Us and more about the work that's happening here in the state. But we thought it would be helpful for you all to just understand who Unite Us is as a company, what our tools offer to our partners here in Oregon. So it's the first time I've used one of these clickers. All right, there we go. So just right off the bat, I'm curious to hear how many of you have ever heard of Unite Us or heard of the Connect Oregon network, just by a show of hands. Okay, great. I'm seeing a number of hands up. That's awesome. So you've probably heard most about the Connect Oregon network. We're really fortunate here in Oregon to have one of the strongest networks supported by Unite Us across the country. So a lot of states across the nation are looking to Oregon to see how does Oregon use what is commonly called community information exchange to improve efficiencies and streamline how individuals are connected to services. So one thing I just want to say right off the bat, we get a lot of questions, is this replacing the work that navigators do? The answer to that is no. This is a tool in a system to make their work easier by improving how we streamline connections to care. So a little bit just about who our company is. We were founded by 2 veterans about 13 years ago. And upon discharge, they were navigating a social care sphere that was really fragmented. They were telling their stories multiple different times to multiple different agencies, and they just thought there's got to be a better way to do this. And so they set out to design a tool to increase efficiencies in the way that we coordinate social care, so things like food and housing for individuals. And so fast forward today, we see our tool is being used in a number of different sectors, so certainly not only for veterans, although that is still a really primary focus for us. We work with departments of corrections and sheriff's departments across the country. We work with child welfare departments and healthcare providers and health systems. And so we've really grown to be a tool that really does this true facilitation of cross-sector collaboration around clients' social care needs. And so our mission is really to bring together communities through this one operating system. And across the country, we've been able to facilitate over 50 million connections to care. And we've seen 88% of the needs that have come through this platform be resolved. So that's an incredible number, but also just the ability to have that number and see this resolution rate is something that I think our partners across the country are really proud of. I have this desire to stop and ask for questions, but I guess we'll do that at the end. So it sounds like a lot of you have heard of Connect Oregon, so you'll know that Connect Oregon, the network is powered by Unite Us, and the goal is really to connect cross-sector stakeholders through this shared technology. And the purpose is to more efficiently and effectively get folks connected to the services that they needed. So the primary way that we facilitate that is through what Tim was saying around the closed loop referrals, being able to really securely share client information between partners. And then I think really importantly is tracking outcomes together. So Tim was saying, after they leave our 4 walls, how do we know if they got the services that they needed? And a lot of this is happening over phone calls, emails, and so bringing it into one kind of system where we can see all of those outcomes at an aggregate level to identify within our communities and across the state where are we really succeeding and helping folks to have the services that they need to reduce recidivism, and where are there gaps that we can proactively address as partners to make sure that no one's falling through the cracks, and the aim is that would lead to reduced recidivism. All right, I'm actually going to move through these slides quicker than I was for those last few, but if you've heard of Connect Oregon, you might have heard that it was developed in the CCO space. So we did develop the network in partnership with the CCOs in the state, but we're at this really exciting place in the network where we're seeing different state agencies come to the table and start leveraging Unite Us and the Connect Oregon network for their own purposes. And so, for example, the Oregon ODHS Office of Resiliency and Emergency Management is using our tools to help folks after disasters to get them connected to services. And so across the state, since the network development, or the network was started in 2019, we have served over 53,000 clients and facilitated over 101 cases. There are over 8,000 services available on the network. And I think the most important thing that we're all really excited about is the time it's taking to respond to a referral. So when an individual sends a referral to a receiving organization, that time is only 1 day. So we know that when an individual has a service need like housing, that's super urgent typically. And so having the ability to know people are getting connected to services within 1 day is pretty impressive, and something I think the network partners can be really proud of. All right, so I mentioned that across the country, Unite Us works with departments of corrections and sheriff's departments to support the reentry effort. So from those partners, we've heard that there are a number of ways that Unite Us can help, but these are the 3 top ways. One is reducing fragmentation that can exist between the justice system and then community-based organizations and healthcare providers, so really bringing everyone into one common ecosystem. The biggest one that we hear is difficulty tracking the outcome and also the impact of access to service needs. And then lastly is these heightened privacy considerations. And so when we're dealing with individuals who are justice involved, adults in custody, youth in custody, we know that there are heightened privacy protections. And so that makes it really tough when we're trying to collaborate with a community-based organization. Maybe they're small and they don't have a sophisticated technology infrastructure, and so they don't have the privacy protections in place to be able to collaborate with agencies like sheriffs, with jails, and with departments of corrections. So just touching again on privacy, if Mamone was here, Mamone is Tim and Brent's primary contact at Unitas. She would tell you that she used to work for a really small community-based organization, and they did have limited IT capacity, and so they were the target of threats, and they actually had their systems hacked 3 different times just in the time she was working there, and that's no fault to a community-based organization. It's just one of the things that they navigate, and so Unitas gives community-based organizations the ability to collaborate in a really secure way. We're compliant with HIPAA, FERPA, 42 CFR Part 2, and we're in compliance with all of the strictest federal regulations around information sharing. I'm going to just move forward. So Tim mentioned that for the CCOs and thinking about the health-related social needs at the waiver, one of the priority populations is folks who have been released from incarceration in the past 12 months. And so I bring this up because Unitas, in our partnership with the CCOs, is operationalizing some of the workflows to get individuals connected to services that are reimbursable under the waiver. So the CCOs that you see here on the screen, Pacific Source Care Oregon, CPCCO, Jackson Care Connect, Trillium, IHN CCO, UMCON Health Share, just listing those out because it's relevant to everyone's regions. Those CCOs are leveraging Unitas to support the workflow wherein an individual can be identified as being eligible for a health-related social need. So in this case, an individual exits incarceration in the last 12 months. And then they send a referral through Unitas, and within the platform, there's eligibility checks and authorization approvals that happen, and then the system actually generates an 837 claim once the service is delivered, so that community-based organizations don't have to learn how to bill Medicaid for these services. So just bring this up to demonstrate kind of how these linkages all fit together. All right. I'm going to transition to talking a little bit more about the pilot. I feel like I've talked for a long time. So do you want to talk through the pilot program workflow a little bit more, and then I can chime in?
Sure. So as I said before, the Sheriff's Association thought this would be a good idea for our jails to try to find ways, especially in our smaller communities, to reconnect people to their resources when they're released. So we originally identified 3 jails of all different sizes from 3 different locations within the state. And the concept was we knew some were going to have more users enter the system than the others, and the hope was to try to get a good wide variety of what that clientele might look like based off of the amount of resources available in the community, because we know that what might be available up in the metro area is not going to be available over in Harney County or Malheur County. And so being able to still have the same impact for those areas, we wanted to try to find communities that had a little bit of across the board when it came to resources. So we identified those 3, and then we started the process with Unitas. I can tell you from being someone who's just enough technologically savvy to get myself in trouble, as I started working with the Unitas, with Mamone and Abigail, and they started training some of these users, the end users, to me it seemed to be pretty easy. Like I probably could get in there and do everything I needed to do, and I wasn't going to be able to screw it up. And then on top of that, the part that she talked about a little bit on the HIPAA compliance and the security, there's so much security that was already built into that system that if we're going to have line staff in our facilities doing this work, not all the information is stuff that they should be able to see. A lot of the very specific drug, alcohol treatment related information is not information that our jail staff necessarily need to know about. All they need to know is that they were connected to the entity for that service and the treatment, and that treatment's being provided. So depending on what level you are within the system will determine what information you get to see. So we brought that together, we implemented, and it took about 3 months or so to get through all of the implementation and the training. Some of the agencies that we had on board needed to order up some new equipment, some tablets for the facility, so that the individuals in custody had the ability to access different parts of the platform. And then, of course, now we've been having data come back for a few months, and now we're able to start track where people are, the success rate, and how many people are being connected to those services. And so I'm going to let Brent talk a little bit about Clackamas, because they seem to be a little farther ahead and are in a good position. They're one of the larger ones that we selected that have the ability staff-wise to do a little bit more of this work in-house.
Well, thank you, Tim and Abigail, and thank you for the opportunity to be able to share just the partnership and the good work that the Clackamas County Sheriff's Office and Unitas is doing together to definitely serve and meet a need that there are gaps within the system. And one of those gaps that we've all talked about is when someone is discharged from jail and they are going to either parole and probation, going to court, or deflection of some sort of navigation, is that time in between. And how do we eliminate the barrier that could be a week and a half out, that could be 2.5 weeks out. And one of the great things is in our experience with Unitas at our transition center, when we're able to upload individuals and place them into the program, and once they're released, we know what their needs, we know what their housing needs may be, we know what their conditions of supervision may be, we know in regards to deflection what their court requirements may be, that we click enter, and within sometimes moments, that individual is contacted by a program that has already been uploaded within the Unitas system as a partnering agency with our county. And that has been great. I have the privilege of being one of our newest supervisors at our transition center. And I came from the parole and probation side of the world, and I've been here for about 6 months now. And part of our team within our transition center is we have 2 parole and probation officers that are housed there, and we have 2 full-time discharge planners and myself that are going into the institution, meet with the adults in custody and planning with them. We created a discharge planning and an assessment team. So while we're in there, we are discharge planning for an individual to get out, to be connected to those resources. We're also assessing risk to make sure we're sending individuals or referring individuals to the right types of treatment. They may need inpatient treatment. They may need intensive outpatient treatment. They may need housing resources, veteran resources. We are working in conjunction with our veteran services in Clackamas County to talk more about this as well. And so it has been an excellent resource for us to have in the workflow. We've worked through some barriers, and one of the great things that Unitas has been is the availability if we have questions. I can just get on the phone, I can do an email, I can talk with Mamon, and she's open to hearing some barriers that have presented themselves, open to, hey, let's try this. And we've also implemented, you may be speaking about this, about the self-referral piece, that someone can come into our transition center that is not from jail, or jail, let's say the jail recogs somebody, and they are within at our transition center within moments and sometimes hours after they've been arrested for a crime or the night before, and they are in need of housing. We can set them up. We have navigators there that can set them up, or we can send them to the self-referral piece of things where we have access to computers, they can upload, and they can get services. So we work with those that are on parole and probation, and basically any individual that comes out of Clackamas County Jail to us. So we have a lot. We're unique. I know there's other programs out there that have this too, but the work that we're able to do inside with the coordination of Unitas and our discharge planners and case managers has just, it's been great. And it's all about the collaboration. And like Abigail said earlier as well, is one of the main benefits is to eliminate these barriers for folks. And so not to replace anybody, it's to make the navigators, discharge planners, and parole and probation officers' jobs easier to have a central hub to work through. And so that is just part of some of our experience that we've had. And I'm open to any questions afterwards as well.
Wonderful. Thanks, guys. So I think it's always helpful. I don't know if this is helpful for everyone, but it's helpful for me because I now think in workflows. So just to kind of illustrate what exactly this looks like from start to finish. And so there's a couple different workflows that are at play in the pilot. One Brent just mentioned is the assistance request form. And so this is where an individual submits an assistance request form, so a public-facing form that can be placed on any website and is available in the transition center. So individual fills out this form, and it can either go to an internal team of navigators, or it can go to Unitas's care coordination team. And their job is to use the platform to identify referral resources for an individual, or just share a list of resources with them if that individual doesn't want a full closed loop referral sent on their behalf. But they reach out to that client and make sure that they get connected to what they need. So that's one option. But the more common option, which I should have led with that, is for a discharge planner, someone working in the transition center, to send a closed loop referral to a community partner. And then they're the ones using the system to do that navigation. So our care coordination team can act as kind of an augmented capacity, especially when maybe you're having a hard time finding a referral resource for an individual. You can kind of use that as an easy button. I think that's primarily how it's been used. But let's talk through some of the pilot activity. Actually, I'm going to stick with this workflow piece for a second. So this is a real-life example that happened in Clackamas County. Thank you for providing this. Do you want to talk through it? You want me to? It came from you, so.
I can.
Okay.
So as you guys can see on the screen, we had an individual, a client that was just transitioned from custody, that was in dire need of help, because they said, hey, if I get out, I'm going to go, this is what I'm going to do. I'm going to seek care or self-care in their way that might not be the most appropriate. And so we were able to sit down with them, upload them within the Unitas system, and staff of the transition center utilized Unitas, and the client immediately, and I was shocked of how quickly they got the phone call for housing and transportation. So we had a housing program that we coordinate with, and one of their peer mentors that is associated with that housing coordination come to the transition center within an hour to be able to assist this individual, get them into housing, and we were able to upload them and see that that referral was received. And it was a breath of fresh air for a lot of us that know how valuable that 24-hour time period can be after someone's release. And everybody at the transition staff that I'm working with, our discharge planners, this was one of our examples we refer back to, and we share with clients when they may be hesitant to enter. We talk about that it's not necessarily we're going to get all that information, but we are going to see that the referrals, like we made the referral and that entity we see that contact's been made. a handshake's been made. That is not, even as a parole probation officer, when you do referrals, it may take a while for a program to say, yeah, so-and-so contacted me to set up this assessment, set up that. And so when we see that real-time kind of data, it is reassuring that we know we have done our help and our part in connecting an adult in custody, a member of the public for these types of services, and it's been an absolute blessing.
Thanks. Thanks for talking us through that. I'm glad to hear that. So thinking about examples like that, so far with the pilot, so we're looking at data here from October of 2024 through last month, February of 2025. So about 6 months. Part of that, as Tim was saying, was kind of getting everyone up and running, making sure that we had the tablets, all the right folks were utilizing the tools. And so in that time, we've seen 49 individuals be served. We've got some data on kind of who these folks are at a really high level. So things like the median age, 61% of them have identified as male. I won't go through these demographics in detail, but I think just to call out here, having a really good picture of kind of who's being served and then how are they being served by the network. So when we think about identifying needs, the top social care needs that folks have been seeking, I'm sure no surprise to anyone, substance use disorder treatment. 50% of the referrals made were for substance use disorder treatment. 31%, again, not a surprise to anyone, were for housing and shelter. 5% for mental health, behavioral health, so counseling, et cetera. 5% were for employment. And then in the 2% to 1% range were things like individual and family supports, benefits, navigation, food assistance. And so being able to just have a really clear picture of what Oregonians' needs are as they are exiting the jails, I think has been pretty powerful. And then the last thing I'll say is that we've also seen an average of 1.27 needs identified. So what does that mean? It means that in addition to having, so the top need being substance use disorder treatment, in addition to that need, folks typically have co-occurring needs. And so being able to look at one client's profile and see they were connected to substance use disorder treatment, yes, and then they also had a need for housing that they were connected to, versus phone calls or emails. We're not seeing always that full client picture in one easy place to coordinate with partners. And then in terms of, so we looked at earlier across the state of Oregon, the standard time or the median time to referral acceptance was 1 day. In the specific pilot, we're seeing about 2.2 days. And so we certainly have those amazing instances where it is by the minute. But overall, we're seeing it takes about 2 days. And so I think I think that's amazing. And I think we do have some work to do, just make sure that folks are always getting connected to services really quickly. But I hope that's helpful to see just a breakdown of some of the data that's been gleaned from the pilot so far. And then these stories, the anecdotal data around connections to care are always really helpful. So thanks for providing those.
Yeah, and I think the only thing I would add to that piece is, as you guys heard previously with the deflection programs coming on board, it takes people a long time to actually be willing to say, I need help. And what we're seeing in deflection is the same thing you're going to see in a correctional setting. Individuals who are in custody, there's a small percentage that are going to say, no, they're good, they don't need any assistance. And part of the process is having the staff trained and in a position where they're able to have conversations with these individuals to get them connected into the services. And as I go through, as we talk about, what the project looks like, I sit here and I think about all the things that we could possibly do. We've had conversations with different deflection coordinators across the state, and with the deflection work that we're doing with these entities, having the ability to enter someone into one database with that deflection work, in my mind, would be great for those deflection coordinators to be able to track where their clients are going through. And so, the conversation continues. What are other ways that we can engage with individuals in the community, whether it's through deflection or just the reentry conversation? I remember when I was in middle school, high school, somewhere in there, it's been a while ago, I was told a story about the kid walking down the beach with the starfish. I'm sure you guys have all heard the starfish story. Anybody heard the starfish story? I like to put my own twist to it because every time I tell it, it gets a little bit different. But, little kids walking along the Oregon coast right after a big storm, and there's thousands of starfish laying out on the beach, and he's walking along, picking them up and throwing them into the ocean. And then this other guy, probably from the metro area, all dressed nice and snazzy in exercise gear, is running down the Oregon coast, which I would never do. But he is. And he goes by and sees this little kid, and he stops, and he's like, "What are you doing? What's going on here?" And the kid's like, "Oh, I'm throwing these back in the ocean. If they get back in the ocean, they're not going to survive." And he's like standing there looking around. He says, "You see how many thousands of starfish there are? You really think you're going to make a difference?" And then the kid looks at the one that he has in his hand, and he throws it back in the ocean. He says, "Well, I made a difference to that one." And so that's kind of my montage. That's kind of what I've taken with me through my entire career, is that if I can help at least just one person get themselves into treatment or get themselves into the position where they can make themselves better, it may take 5 or 6 bites at the apple before we get there. But for that one particular individual that we're dealing with at that moment in time, it makes a difference to them. And when we had this opportunity to partner with Unitas to start this pilot, of course, we're going to continue the conversation of how can we make this continue past this pilot? How do we get this out to jails across the state? Because I think it's super important for frontier counties, metro counties, all across the board in the state to be able to have access to this type of technology. When I was a deputy a long time ago, I had this trifold flip card that I carried in my pocket of my uniform, and I opened it up and it had 80 different phone numbers for different resources in the community, and I didn't even know where they all were. All I knew was it was a name and I had a phone number, and there is no way that we can continue to operate like that in our communities. We need to do better, and I think this is a great opportunity to do better.
Thanks so much, Tim. We're so excited to partner with you to just make sure that everyone who wants to leverage this tool to serve the folks that you do and continue the good work that you're doing have access to it. I realized that I left out one really important piece, which is that we have a partnership with 211 Info, where their resource directory is ingested into the Unitas resource directory, and so all of the 211 info is available in Unitas, and many of the resources there accept that closed loop referral, and so they're just an incredible partner. They're instrumental in the HRSN work, so I would be remiss if I didn't call out our partnership with 211. Anything else from you?
I don't believe so.
Well, thank you so much for inviting us here to talk with everyone, and thank you for your partnership. Thank you so much for your partnership. And yeah, happy to take any questions. Thanks everyone so much for your time.
So the first one refers to one of the slides in your presentation. It says, your slide highlights predicting risk. What outcome are you predicting? Also, is the Unitas data available to program evaluators who are hired by the participating agency?
Yeah, that's a great question, and I'm glad that predictive piece struck a chord. That's not something that's in play right now with the Oregon State Sheriff's Association and our county partners, but it is something that's in play in the state. So Unitas has a tool that makes it possible to predict risk of having social needs and the interaction of those social needs with clinical needs. So we're able to identify actually down to an individual level or a community level. Folks who live in the zip code are at higher risk of having an unmet housing need and maybe also having substance use disorder. And so actually this is a great example, not totally applicable to us here today, but the Office of Resiliency and Emergency Management, for example, could use this tool to identify in a disaster where are there individuals who might have unsecure housing and also have a substance use disorder, and to identify how we can serve those individuals best in the event of a disaster. But for this, well, I think that probably answers the question, but I'm happy to dive deeper into it. I won't go on. This is one of my favorite things that we do, so I could talk forever about this.
So the next one says, what is the minimum amount of information about an individual that is required for someone to be referred into the Care Oregon system via Unitas?
Such a great question. First name, last name, date of birth. And if needed, you can use, what is it called when you use a name that's not someone's real name? An alias, thank you. Yeah, first name, last name, date of birth. And then I realized that I didn't answer your question around evaluation. So the data that's generated through the Unitas platform in an aggregate level is available to our partners. So we would work with the partner to make sure that they approve sharing it with an evaluator, but yes.
This says, besides Clackamas County, what other jails did OSSA select for the pilot of Unitas?
Very nice. So we originally started with Jackson County, Clackamas, and Yamhill County, right across the river. But now we're down to just Clackamas and Yamhill. We're looking at and had conversations with Marion County. The only concern with Marion County is the longevity of the program, and since we're getting close towards the end of the pilot, what would that continuation look like? And so we're going to continue to have those conversations. But those are the two right now, Clackamas and Yamhill.
And I can provide a little bit of color around Jackson County. They had a workflow that they had already stood up around connecting to peers that was working really well. And the referral workflow was just like very routine. And so they were finding that it was actually more helpful for the peers to just come into their transition center. And so, yeah, still certainly able to participate if they're interested, but for now it made the most sense to just have that in-person handoff happening.
As a part of the tool, have you done any community resource mapping? If so, how has that been conducted?
Yeah, really great question. So I know community resource mapping can mean a number of different things, like asset mapping and identifying assets in a community. I think from a Unitas perspective, when we think about community resource mapping, it looks like a resource directory where you can enter where an individual spends the majority of their time, knowing that individuals don't always have a stable address. So enter where they spend the most of their time, and then you can see resources within closest proximity to that individual, and be able to filter down those resources to ensure that they're the right match for that individual. So taking into account eligibility criteria, which in the justice involved space, we know is really important to be able to filter down resources who are committed to serving folks who've been involved with the justice system. That comes into play a lot when we partner with departments of corrections. Hasn't come into play so much yet with this pilot.
This one starts with a thank you to the panelists for your presentation. They had been some meetings with the platform in early 2021, and they're wondering if this is a new version or can community-based organizations join to be a part of the referral network?
It's the same one. We've been doing this work since 2018. I'm privileged to have been a part of it since 2020. So yes, community-based organizations are invited to join the network at no cost. Community-based organizations will never have to pay to participate in the network. We never want that to be a barrier to engaging. And the way that we think about engaging with our community partners is typically led by our partners or our customers. So it was initially led out of the CCO space. So we asked them, who are your key community partners that you want to send referrals to? And then we have a team of community engagement folks who work with community partners. They sit on community action teams. They're out in the community building those relationships. So community partners realize the utility of the platform for their own needs, not just receiving referrals, but tracking data and sending referrals as well.
Does the Unitas system allow assessments such as an LSCMI, WRNA, and case plans to be uploaded and then accessed by the providers that need it?
Yes, I have to admit I don't know that acronym, but yes, we are able to create custom forms that can be used to do things like pre-release planning, which is actually something that we're going to start exploring with Clackamas County. But yes, we can build in custom forms so that the social needs are captured in one place, and we can make it so that if that form is private just to your organization or shared with other network partners based on the type of information included in the form. I love all of these questions.
I'm going to combine kind of two questions. First, people want to know how much longer the pilot has, and then can you elaborate on the next steps or any challenges then of expanding the pilot?
So the pilot's currently scheduled to run through the end of June. But we've had conversations about trying to find other ways to have funding available for communities to be able to apply for funding to put towards this project. So as we continue the pilot, we're talking with our sheriff's offices across the state. Most of them are the jail commanders who could see a need for this. And then once we get an identity of how much what that need might look like, then we'll have the ability to go back to Unitas to start having those conversations. But the initial pilot was for 1 year through June 30th.
Yeah, and in terms of for next steps, in addition to those, with Clackamas, we mentioned we're starting to explore using Unitas outside of the transition centers, so working with possibly parole and probation, thinking about how to identify social needs before an individual is at the transition center. So I know those are more kind of tactical next steps. And then if anyone is interested in learning more, you can reach out to me. I'll put my information here up on the screen. You can reach out to Tim, or you can reach out to myself, reach out to Brent.
Is the risk tool validated? And if so, what is the name of the tool that is used?
Yeah, great question. So the tool pulls from multiple different indices. I'm happy to dive into each of what they are at a later date. And then it also uses what we have learned across all of our networks across the country to really hone in on social needs risk. The tool is called Social Connector.
And then there's a handful of questions just about funding and cost. How much is it, or how is it being funded?
Yeah, so right now, Oregon State Sheriff's Association, with funding from the CJC, is funding the pilot. So we're working together to implement the pilot across the counties. I think moving forward, we're trying to figure out what the right model looks like in terms of funding. So right now, yeah, OSSA is providing access for the counties who are participating. Anything to add there? No. Okay. Oh, and I guess I should say in terms of just how we think about the cost of the technology, we think about things like population served, number of users, what do workflows look like, how many community-based organizations will be engaging with. So those are all the kinds of things that we take into account when thinking about the cost of the technology and the community engagement support.
All right. Well, thank you for being here. Thank you for having us. We appreciate the opportunity to share a little bit more about what the program looks like. As Abigail said, if you have any questions, reach out to us offline and we can hopefully answer everything you might have. Thank you.
Thank you so much.